Today we're going to talk a little bit about Medicare. I'm sure you're starting to see the commercials. They're all over the place talking about Advantage programs and all these great things that Medicare has to offer. Let's just talk further about different types of Medicare and actually what is it? So Medicare is a federally funded program. And you'll hear things like Part A. What is Part A? Part A covers hospital stays, and it may cover some rehabilitation services, and it may even cover some home health when someone is discharged from the hospital, but that's limited. Then you'll hear about Part B. Part B covers physicians' offices, lab visits, durable medical equipment. And what I mean by that is things like walkers and wheelchairs and stability tools that help people maneuver around their homes. And then you'll hear something called Part C. And this is important because Part C actually replaces Part A and B. So if you elect to have Part C, which is considered a Medicare Advantage program, that replaces Parts A and B. Then there's Part D. Part D is a prescription drug program that's a supplement to Medicare, requires you to pay some copays. If you're already involved in one of these programs, it's really important to know that in the month of September, you're going to be receiving some information from your current provider. And every year what they do is they evaluate their current plans and then they inform their clients on what the plan is going to look like for the next year. So let me just give you an example. Let's say in 2019, your mom was diagnosed with high blood pressure. She's on some medication. It's a chronic condition for her. She's going to be on it for many years. And it's covered in 2019 under her current plan, under her Medicare Advantage plan, Part C, if you will. But next year, they're removing that drug from the coverage. So that means if she wants to continue to stay on that drug, you're going to have to pay out of pocket for that. So I can't tell you how important it is for you to read the fine print and just take a look at that annual summary, because during the time frame that I told you earlier, October to December, that's the time when you can switch plans. So if something isn't going to work for you in 2020 or isn't going to work for your parents in 2020, this is the time when you need to make that decision. This is the time to shop and speak to an independent insurance agent. And I would encourage you to talk to an independent agent because they have access to multiple plans. The other thing that's important to know is that these plans can vary by state. So if you've got Medicare plan Part A and Part B and you move, chances are things aren't going to change much. But if you got Part C and you move from one state to the next, things can change. So lots of balls in the air, and it's really important to pay attention to the details. Click the link below to gain access to Reinventing Aging, where we share all things senior care, from Medicare enrollment to senior scams. Take good care. We'll see you next time.